Hi, I'm Dr. Dori Carlson. I practice in Park River, North Dakota. I'm a vision source practice. And Dr. April Jasper and I came up with an idea a little while ago that it'd be kind of fun knowing that there's a changing in the demographics of optometry, that even though we're all optometrists, maybe women approach cases just a little bit differently. We kind of thought it'd be fun to explore some of those things that we might do a little differently than men, or maybe not, and just kind of have some fun with the class.
My name is April Jasper, and as Dori said, one of the things that we thought would be fun and also maybe really help some people out there is to talk about different cases that we've seen in our office, and also talk about things we've really done in our practice that have been important in helping us to get back to our families as fast as we can in the day, be important to help us with our efficiencies. And maybe it's different than the guys out there, maybe it's not, and that really isn't as much the point as it is just to really look at how we look at things from the female perspective.
We're going to be presenting a couple of cases. April, why don't you talk about your case?
So my case is about a patient who comes in who is a female patient, just happens to be, who comes in with vision loss that she's had all her life. She's now pregnant, and she's just here from Cuba. And she comes into our practice and wants to know what's going on with her eyes. It's her first eye exam ever, and she wants to, her actual request was, chief complaint request, what I want you to do for me today, doctor, is I just want to see my baby when she's born.
My case is a little bit different in the sense that it's about when the doctor becomes the patient and the lessons learned from that. I was patient number 15 in our office for an EKC epidemic. And so I got to experience firsthand what it was like to have EKC and actually be out of the office for 2 weeks and quarantined basically in my house because of the fact that I couldn't see patients. You know, the female perspective of that part of it was that, you know, I have no pigment. And even though I knew how contagious this was, I chose to use 2 different tubes of mascara so that I could have mascara on each eye. And some of those things that sometimes we don't think about, and it made me really think about how I might present contagious issues or just even general health issues to my own patients about makeup and different things that maybe a man wouldn't have those necessary conversations with.
Yeah, you know what? It brings up a good point. Until you actually have a patient that you're seeing in a certain situation, such as this one who's pregnant and she has bilateral retinal detachments, and here she is finally seeing for the first time after being fit with contact lenses, and then she has to make a life-altering possibly decision on, do I wait to have surgical repair or do I do it now? And as the optometrist, you're thinking about her and her situation, but also thinking about, now I'm the doctor, what is it that I'm going to do for her, and what am I allowed to do, and medical legally what do I do? And you know, so many questions, and it really is so incredible to be in those situations, to be able to change people's lives. And I think it's interesting to see how we come about these cases in a different way, maybe.
Certainly, sometimes we have a little bit more empathy because you can put yourself in somebody else's shoes a little bit easier.
Yeah, so we are excited about it. We think that it's something a little different, maybe something that you haven't experienced in the past, and we hope that somehow it helps to bring value to people in our class.
And then we hope to have fun while we're doing it.
So one of the interesting things about our practice, I actually graduated from optometry school, did a residency, moved to Tallahassee, Florida, where I worked in leased space in 3 different Walmarts. After 6 years of that, moved back home, and I bought a practice back home in West Palm Beach, and so purchased a practice in 2002, joined Vision Source in 2003, and it has just been an incredible journey for us, my husband and I, being able to build our practice and really see patients come in and be able to change their lives.
And I'm a 1989 graduate from Pacific University, did a residency at a VA in Seattle after that, and while I was in optometry school, met my husband, Mark Helgeson, and the two of us, after we both did residencies, we ended up moving to North Dakota, and we opened our own practice cold. No patients to start with, in a hospital in about 500 square feet, built up that practice, and about 3 years later, we bought another office from a doc who was retiring. And a few years after that, we joined Vision Source, and it's been really gratifying to watch our practices grow, our locations, and we're busy and adding on associates. So I can look back and be amazed at how many years it's been and how fun it's been.